be aware of the most dangerous form of skin cancer, malignant melanoma. With summer vacations just around the corner, people are thinking of bronze bodies and the beach. Lots of free time sunbathing and swimming with little attention being focused on over 1 million cases of skin cancer being diagnosed in the United States every year. With proper education and protection, this cancer can be easily prevented. There is a positive side to this deadly disease. You can do a lot to protect yourself and your family from skin cancer. If skin cancer is detected early enough, it can be treated effectively. Most melanomas are caused by too much exposure to ultraviolet rays from the sun and tanning beds. Skin cancer is the most dangerous form of cancer, causing an estimated 9,710 cases of people who have died yearly. Melanoma accounts for 5% of all skin cancers. Melanoma, however, is responsible for all deaths from skin cancer. It is the most common form of cancer in the United States in people from the ages of 25 to 29 years old. Many people today not taking skin cancer seriously, even after knowing all the facts. Melanoma is a growing problem in the United States, and millions of people suffer from it every year. There are 3 main types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. In this presentation, I plan to discuss all 3 types. The first one and most common skin cancer is basal cell carcinoma. This cancer develops in the basal or the bottom layer of the epidermis, which is the top layer of your skin. The cause of this cancer is a gene called PATCH, or PTC, which helps control cell growth and development. If this gene is missing or damaged by ultraviolet light radiation, unrestrained cell proliferation may result. This carcinoma usually appears as a small fleshy bump, which often appears on the head, neck, or hands. This doesn't spread quickly and can take months or years for one to grow to 1.5-inch diameter. If untreated, it can bleed, crust over, heal, then the cycle repeats itself. Some of the treatments of this condition are from dermatologists, may perform therapeutic options in an outpatient session. Local therapy with chemotherapeutic and immune modulating agents is useful in some cases. With small and superficial, BCC may respond to these compounds. Topical ointments may be one type of treatment if the cancer isn't on the face. Radiation and surgery can be used as well. The second most common is squamous cell carcinoma. This cancer develops in the upper layers of the epidermis. This is an aggressive cancer. It is still relatively slow growing and is more likely to spread to other body parts, including the internal organs. Squamous cell cancer is usually found on the rim of the ear, the face, the lips, and the mouth. This disease is usually painless, but may become painful with the development of ulcers that do not heal. This cancer originates from sun-damaged skin and usually begins at the age 50. When found, it looks like red scaly patches, open sores, elevated growths with a central depression or warts. They may crust over or bleed. They can become disfiguring and sometimes deadly if allowed to grow. The cause of this disease is continuous exposure to ultraviolet light over the course of a lifetime. Daily year-round exposure to the sun, intense exposure in the summer months, and the UV rays produced by tanning beds, all added to the damage. If found in early stages and removed promptly, all of them are almost curable and cause very little damage. If left untreated, however, it will eventually penetrate the underlying tissues and become disfiguring. Some may cause massive size to lymph nodes, other tissues and organs, and become fatal. There are several treatment options. After a biopsy and depending on tumor size, type, location, depth, and patient's age and health, the patient is an outpatient and a small thin layer of tissue is removed. Sometimes it takes several surgeries to remove the affected area. After removal, the wound will heal naturally and cosmetic surgery may be needed. The third type, and the most dangerous, is malignant melanoma. This cancer develops in the pigment cells which are found throughout the basal layer. It develops when unprepared DNA damage to skin cells, most often caused by UV radiation from the sun and tanning beds, triggers mutations that lead the skin cells to multiply rapidly, producing malignant tumors. They often resemble moles that are black or brown, but they also can be the color of your skin: pink, red, purple, and sometimes white. There are several causes, but increased risk depends on sun exposure, number of moles on skin, and skin type and family history. Hereditary plays a major role in melanoma. About 1 out of 10 patients diagnosed has a family member with this disease. A person stands a 50% chance of getting melanoma if a family member has it. The treatment of melanoma is removed by outpatient surgery. Some can be removed in doctor's offices under local anesthesia. Stitches are used to heal the incision. If the melanoma is larger than the cosmetic surgery may be needed. This cancer has about 48,000 new cases diagnosed yearly, with about 7,700 people dying from it every year. From the American Cancer Society, risk factors for all types of skin cancer include skin that burns easy, blonde or red hair, a history of excessive sun exposure, including the sunburns, tanning bed usage, immune system suppressing diseases or treatments, all have a history of skin cancer. Also, from American Cancer Society, the 5-year survival rate for people whose melanoma is detected and treated before it spreads to lymph nodes is 98%. The World Health Organization estimates that more than 65,000 people a year worldwide die from melanoma. Now, the next time that you go to get in the tanning bed or lay out by a pool, remember more people develop skin cancer because of that than people do develop